What's unique about the wrist procedures that I do is I do wrist arthroscopy, which means that I can put a small scope into the wrist joint itself, and there's a lot of small problems that we can take care of through that. There's a cartilage on the outside part of the wrist that gets torn that will give you popping and clicking in the wrist that can be painful. That can be repaired through the arthroscope or treated through the arthroscope. There are some small ligaments in the wrist that if they tear could lead to arthritis down the road, as well as causing pain after the injury. Those can be taken care of through the arthroscope. Arthritis, you can buy someone some time with arthroscopic surgery for wrist arthritis. So that's something that's relatively unique to my practice. There's only a couple of us in the area that do wrist arthroscopy, but it's something that I found to be very successful and very helpful for people. What do I do that would be more considered advanced technology? Well, a couple of things that come to mind for me personally is arthroscopic rotator cuff repair. Even in the 15 years that I've been out of residency, rotator cuff repair has gone from big open incisions to all being done with 4 tiny one-stitch incisions. So, and that's been within the last 5 or 10 years that has really come into vogue and been a lot more mainstream, and I do that. The other thing that I do is relatively unique is wrist arthroscopy. There's not a lot of people in the area that do small joint arthroscopy. So that is, and I can repair ligaments or even repair cartilages through the arthroscope of the wrist. And those are tiny little scopes and tiny little incisions. So that's something that's more advanced technology that I do. As well as a partial knee replacement. The models of partial knee replacements have advanced greatly over the last few years, and it's something that I've added and have been very happy with, and I think patients rehab a lot faster and are much more comfortable after that surgery if they're the right candidate.